If a doctor has recommended a neck dissection, you're likely planning treatment for a head or neck cancer. Neck dissection removes lymph nodes and surrounding fatty tissue from one or both sides of the neck. Head and neck cancers often spread first to these lymph nodes, which is why doctors target them. Surgery is done to treat nodes known to have cancer or to remove nodes at high risk of hidden spread. There are three main types. Selective removes only certain levels. Modified radical removes all five but preserves key structures. Radical removes everything. Modern surgeons aim to preserve the shoulder nerve, the jugular vein, and the neck muscle whenever cancer allows. Under general anesthesia, the surgeon makes an incision along a natural skin crease and removes the lymph node groups. The pathologist then examines each level separately, mapping exactly which nodes contain cancer to guide next steps. Most patients stay in hospital 3 to 5 days. Small drains manage fluid, and gentle shoulder exercises begin early. Shoulder stiffness, neck numbness, and tiredness are common early on. Structured physiotherapy over months restores function. Risks include bleeding, infection, chyle leak, nerve injury, and lymphedema. High-volume centers tend to have lower complication rates. Depending on pathology, radiation or chemoradiation may follow surgery. Regular follow-up continues for at least 5 years. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.